Hello, Ms. Pridden. My name is Dr. Grant Matheson. How are you today?
I'm well, thank you.
Another Anglo-Doc, young as my grandson, here to practice on our people. Practice medicine, they call it themselves. I wonder how much practice he'll need before he's ready to leave the reservation.
Well, Ms. Pridden, what brought you in today? How are you?
I'm feeling some way.
I'm feeling some way, the old grandma tells me, as if the meaning of her words were apparent, or as if words were beside the point, and the secret of her sickness hidden elsewhere.
Well, what do you mean some way? Is there pain in your head, in your chest, or your lungs? Does your urine come too fast? Do you sweat in the night?
Before I can answer, he asks something else, interrupts me again and again. Must be that my answers are not so important as the questions themselves, or else he would wait.
Well, yes, I sweat sometimes. No chest pain.
And this is true, or none today anyway, none since walking the hill last night, but he is in such a rush that yesterday must not matter, so I don't bother with this detail.
Cannot blame her, of course, since my concepts are so foreign. Medications and allergies, even illness itself, so far as I know. But how am I to help her?
Well, what pills are you taking, and why do you take them?
I don't understand why they ask and ask and ask and ask so many questions when everything is there in the chart. Why else do they spend all their time writing, even as I speak, even as they speak, if not so they can read what is sick inside me?
I peruse the chart quickly, one eye on my patient as the other skims the pages. But my extraocular muscles aren't built for such work, and within minutes my head is pounding.
We have men of our own who understand, who bring us the herbs and sing us the songs, but these Anglos give pills to take my bad sugar away, so I try to help them as best I can, try to explain in clear, simple terms what makes me sick inside.
Well, where is this pain that you're feeling? Is it in your belly, or is it in your back? Is it in your belly, or is it in your back?
Can't you just describe the symptoms like a normal person?
Asking so many separate things as if they were more than one thing, more than just this one ache where I breathe and the wind in my lungs, saying spring shall come late, and the sheep and my grandchildren hungry, and water so scarce so it's farther to walk, and my old knees too sore so those shortcuts over instead of around, except then there's heaviness on the hillside, but there are no such words in his language.
I suspect she wants nothing more than her prescriptions refilled, just one of her monthly routines. Get the white pills and the purple pills that the Anglo doctors dispense.
So I lie, though not cruelly. I lie so as not to offend him. More practice, I think, and he may learn his medicine, as our own healers learn ours. But for now I should not offend him. Yes, that's it, doctor.
Just my pills. Can I please have more of my pills?
But your sickness, you came to me sick.
I'm fine. I was sick, but now I'm fine.
Perhaps that was all she needed, just to be seen, to be heard. She seems better for having come. I will refill her pills, and this alone, this dance of our encounter, will help her feel well. My own head stops its pounding. I begin to understand.
Yes, doctor, thank you. Can I have more of my pills?
Yes.
This is an illustration of how culturally based preconceived notions turn into unvoiced expectations that then turn into unmet expectations. In this situation, both patient and physician are letting their prior experiences affect their meaning today. This article is related to developing cultural competency. The Anglo physician and the Native American patient approach medicine in two fundamentally different ways. The Anglo doctor thinks linear and hopes for bullet points, whereas the Native American patient thinks circular and explains her symptoms interconnected in a story.
What would be the intent of the provider and the patient, and how do their individual worldviews influence these intentions?
Discuss your experiences with cross-cultural communications and compare your experience to this scene. As a future physician, what strategies will help you communicate with those from other cultures?
I was lost in the lakes and the shapes that your body makes, that your body makes, that your body makes, that your body makes. And the mountains said I could find you here. They whispered the snow and the leaves in my ear. I trade resolve. I could tell them